you for inviting ACP to co-host this event. And I think we did several things before in the past many years, since both organizations very active in the Chinese community. And also would like to thank you, Benjamin, for your New York Life Insurance supporting this event. And that's great. I think we'll benefit for this. And also I would like to thank you, ACP board, and I think we have 5, 6 board members, and even we have a member from UGA. He drove a long way to here listen. He's interested for this topic. And thank you for, before the meeting, I chatted a little bit to Chairman Sale regarding, I'm also working on this, healthcare insurance area. So lots of terms like HIPAA and this Parker is very popular. So we'll discuss a little bit later, when the Q&A session opens. So I'm very, very, interested for co-hosting this kind of event in the future. And thank you for this opportunity for ACP, and we'll work out this. Thank you.
Thank you, Julian. Before we start, we do have refreshments and the drinks in the back, and thanks to Rimmer Sale, the president of D2E Resources, they provide the refreshments for us. I had the opportunity to meet Rimmer like last month.
It's close.
Yeah, it's close. It's about a month now. So we sat actually at the same table, and we had a great time chatting about doing business with China, because Gwinnett County, Rimmer is also the chairman of the Gwinnett Chamber of Commerce, in addition to be the president of his own company, D2E Resources. So Gwinnett County has been a big supporter of attracting business, Chinese business to the U.S., especially to Gwinnett County, and as well as establishing the business relationship between China and Georgia. So I had a great opportunity to know him, and this event came up, and then we thought about, everybody has already watched the political party conventions, and I think the healthcare will be a very, very key factor for this upcoming election in November. Not only that, it also affects every one of us here. It affects your business, your family, and yourself. So this is a very important topic, and with that, I'd like to invite Rimmer Sale to come up here.
Thank you very much. Appreciate it. Thanks, and I appreciate the opportunity of being here. I'm the only one in the room that has no clue what was said just before, so I don't know whether he was talking about me or not. I was not born anywhere near China. I was born in North Carolina and don't even do very good service to the English language, so we'll just go from there. If you have any questions as I go through this, please feel free to ask. I've taken 2,700 pages of federal information and shrunk it down to 14 slides. So you just know how compressed this information is going to be today. Are we on? We got to get warmed up here.
Yeah, just a minute.
While we're doing that, I have, if I can pass this information out to you, this is a copy of the presentation that you'll be getting this afternoon, and you will make notes on it if you can. There's a couple of pieces in here that I'll refer to that are not on the slides. And if you need to pass notes back and forth to one another, saying, wow, I'm over Jeff, you write those on this sheet. What we're going to talk about is just a few of the important things that are affecting all of us more immediately in this law. As you know, it was created on March the 10th when the President signed it into law in 2010. It became effective on September the 23rd of 2010, so we're just a little over 2 years into it. Back up. Can you see okay now?
Yeah.
We're a little over 2 years into the implementation, and we have not even begun the process. It is we've just been nibbling along at it, if you will, and the real meat of the programs are going to kick in 2014. But there are a few things that are important to you as business owners and consumers that you need to be aware of. This is the first thing I want to talk about. Does anybody in here have a business that has fewer than 25 employees in it? Okay. Are you taking advantage of the small business tax credit? That became effective, it was effective in 2011. It's again effective in 2012. And the summary here is if you have 25 or fewer employees and the average income is less than $50,000 a year, you can receive up to a $20,000 credit on your health insurance premiums. Now, there are a couple things you need to know. Owner's wages don't count in this $50,000, so you get to throw the owner and the owner's children out if they're employees. The family members are not counted. Now, I have a company that has less than 25 employees, and I don't qualify. It has nothing to do with the fact that the average income is less than $50,000. There are all kinds of hoops that one has to jump through in order to participate in this. My suggestion is talk to your accountants, get them involved, at least ask them about it and get them to tell you whether or not you're qualified. Grandfathering. Anybody in here got a grandfathered health plan? You know what a grandfathered health plan is? When the law was passed, it became effective on September 23rd, everybody's health insurance plan was grandfathered. And you lost grandfathering status. If you look back in the presentation, you'll see a form that looks like, it's right behind the slides, that looks like this. Now, grandfathering in most cases is no big deal, or the lack of grandfathering is no big deal. The way this law first came out was that if your plan was grandfathered, and that meant that you hadn't changed carriers, they wiped that piece out, that doesn't apply. You did not increase your co-pays or co-insurance or deductibles by more than 15%, you could retain a grandfather status. And if you retain grandfather status, you didn't have to participate in all the wellness benefits, and you didn't have to participate in the non-discrimination rules. Well, as time has gone along, the insurance companies have figured out that if I've got a 10-life group here that's grandfathered and a 25-life group over here that's not grandfathered, it's more complicated to monitor and to process with those two plans than it is just to say, okay, we're going to assume everybody's not grandfathered, and we're going to put in all the wellness benefits in every plan. Now, you have wellness benefits in your plans now. If you're under 50 lives, I guarantee they're in there. Most plans over 50 have them in there. And these wellness benefits, which seemed like they were going to be a big deal, have not turned out to be as big a negative as it was originally thought. So now you have things like you go to the doctor for a wellness checkup. That's no deductible, no co-insurance, no co-pays. It's just 100%. Mammographies, colonoscopies, and the list is about 4 pages long of all these things that have no charge to them. If you go into the doctor and you say, I feel well, I look well, and the doctor says you are well, it's okay, it's a no charge. If you go to the doctor and you say, I look well, and I feel well, and the doctor says, I want to keep a watch on this particular area here, you just tripped over from wellness into diagnostic, and then those things apply. So the insurance companies gave wellness benefits to everybody. We just got on August 1st, I believe it was, the birth control mandate that went in, that I believe it took effect on August 1st. But all of these things are in there. It actually cost your health insurance premium to go up by about 2.5%. So one of the things we're listening to on the political front is that if the health care law is wiped out, those things go away. Aetna, United Healthcare, and Humana have already announced that if they did away with the law tomorrow, completely did away with it, we would not take those things out. And that's standard behavior in the insurance industry because as the insurance industry knows, once something's priced in there and people are paying for it, there's no point in taking it out because they're already paying for it. We know what it's going to cost us. So your health plan, in order to be grandfathered, the only thing now that really is important is non-discrimination rules. Non-discrimination rules simply say that the highly compensated employees cannot have a benefit disproportionately higher than the non-highly compensated employees. Non-highly and highly compensated status are found in your 401k plans. If you got more than 100 employees, anybody have more than 100 employees? Okay, if you had more than 100 employees in your company, you would be dealing with highly compensated, non-highly compensated. They're pushing that down into the smaller groups. Now, that has been suspended. So what's the big deal about grandfather? The only deal that's out there now is the non-discrimination rules will come back. By the time they get back, everybody's going to be non-grandfathered anyhow. That piece of paper that I gave out to you down at the bottom, it's got 11 points. To know if your plan's grandfathered, you must meet all 11 of those points. If you answer yes to anything on there except numbers 8 and 11, your plan's not grandfathered. If you answer no to 8 and 11, your plan's not grandfathered. Number 8 says that you have documents proving what your health care benefits look like on September the 23rd, 2010. Number 11 says you send a notice out to your employees saying, I think our plan is grandfather status, carries grandfather status. If you haven't done that, do it. If your plan's still grandfathered. If it's not, don't worry about it. That's just, I wanted to hit on that because you hear so much about grandfathered plans in health insurance. So, is your plan grandfathered? Do you have the documents? Those are the two most important things. Do you have the documents that you have out for your employees? Documentation in the healthcare legislation is important because you'll see in just a minute, and let's see how quick it is. Well, not up here yet. Well, it was on the first slide. The IRS has responsibility for monitoring this health plan. So if they come to your door and ask you for certain documents, you need to be able to provide them because grandfathering doesn't have a penalty with it, but this one does. Age 26. On September 23rd of 2010, this is the benchmark date for everything, by the way. If you were an employer, regardless of how large or small your company is or was at that time, you had to notify your employees that if anybody had dependents that were 26 years of age or younger than 26 years of age, they could join the health plan. No questions asked. Well, they say, okay, what's the difference between that and the way it has been all along? The way it's been all along is your child had to be in school. Being in school is not a requirement. Your child could be married and living in Tennessee and have 3 children. And that child, if it's your daughter, could get on your health plan. Today, that can happen. So the main thing about that is, how did you notify your employees? That proof of notice is the important thing. How did you notify them? There was a written format that you were supposed to follow to do that. Did everybody do that? I'm guilty. I didn't do it. I mean, the law became effective realistically in October, and all of the insurance industries out there are trying to figure out what the heck we got to deal with. And so I didn't notify my employees with any kind of documentation. But if you interview any of my employees in the company, you'll find out that every one of them knew about it. Because we had meeting after meeting after meeting where we talked about it. Would the IRS allow that? You know, that's up to them to throw it out if they want to. But when the intent to follow the law was there at that time. Employers have also been told that they have to provide the cost of health insurance on W-2s. That has changed a little bit, and now if you issue 250 or more W-2s in the calendar year, and this begins this year, you have to provide the cost of health insurance on the W-2. And it may be, if you're single premium is $400 a month, that's $4,800 a year. You may have to show $4,800 on the W-2. That's going to come back. The reason it's going to come back is there is talk in Congress of revamping our tax structure. And one of the things they're talking about is getting rid of all deductions. Deductions. Well, health insurance is a deduction. And so while there's no tax on this now, it's a reporting item only. I can assure you that it's building a database. Now, if you don't have more than 250 W-2s during 2012, don't worry about it. But these are some things that are going to be going forward that we're all going to have to do. And so you need to be talking to your advisors or whomever you work with your benefits to get them to tell you, how do you plan to help me do this? Because the payroll company will do it. If you have a payroll company, they'll do it. But where are they going to get the information? It's going to be up to you to give them that information, or for somebody on your behalf to give them that information. The next thing is medical loss ratio. Did anybody get a refund from any insurance company this year because the medical loss ratios exceeded certain limits? Beginning in 2011, the insurance companies for small group, now that's defined as 50 or less, could not have a loss ratio of greater than 80%. Groups larger than 50 couldn't have a loss ratio of 85%. Now, what does that mean? That means that 80 cents on every dollar you paying in premium had to go toward paying healthcare costs. If it was a large group, it was 85% had to go toward paying healthcare costs. If it was less than those numbers, the insurance company had to give you a refund. And the way they were doing that, or the way they did it, is they sent the employer a check. I had a client that got a check. I think it was $4,000. There's 300 and some odd employees in their plan. So they got a $4,000 check back, and it had to be distributed to the employees who were active on the payroll at the time. You didn't have to go back and look for historical payrolls. Now, in the small group market, I don't know, Blue Cross, Humana, United Healthcare, Coventry, and Aetna did not issue any refund checks this year. Cigna did in the state of Georgia. All of them issued refund checks all around. This is going to come up again next year. They have to have the end of the year, they have to do a calculation. It has to be in by, I believe, June 1, and they have to distribute the funds by August 1. So if you get a refund, it is important that you distribute that refund. If the employee paid part of the premium and the employer paid another part, the employer gets to keep part of that money and the employee gets to keep part of it. It is a formula that you have to go through in order to be sure that you're distributing these funds correctly. This one is going to get to you quick. Right behind that first page that I showed you is, for the next 8 pages, is a summary of benefits and coverage. This became effective on September 23rd, 2012. And anybody that has a renewal in their company on November 1st or later will have to distribute the summaries of benefits and coverage. Now, here's what happens. That form, that's a sample, by the way. The insurance company has to distribute it to you, and it is specific to your plan. If you have 5 plans of benefits for health insurance, you're going to get 5 summaries of benefits and coverage. It's a pretty good document. I mean, it tells in there, we've been doing this for 19 years in a similar format for our clients, so that they can make a decision on which is the correct health insurance. This just takes it to the consumer level. And it tells you what the deductibles are and what the co-insurance is and what the insurance pays in the network and when it pays out of the network. And the last page is an example of what happens for a maternity. By the way, do you know we have a new grandfather in the audience? This morning, baby was born, right, in California?
我今天做 grandfather 谢谢啊。
So it tells you the cost of a maternity, and it tells you the cost of diabetes, I believe, is the other one. Now, here's what you need to know about this. First of all, if you don't do it correctly, there's a $1,000 penalty per infraction. Mama, daddy, and 2 kids is $4,000. Okay, got your attention now? This has to be sent out in the open enrollment period prior to the renewal. So if your renewal was October 1, the law didn't become effective until the 23rd of September, so that didn't apply. It's November renewals that apply, and it has to be distributed in October of this year. You'll get it from the insurance company. Every insurance contract has been amended to say that you, the employer, will hold the insurance company harmless if you violate the law. So now it's not only Uncle Sam you got to worry about, it's the insurance company that you're saying, I'm going to hold you harmless if I mess up. In case they get sued by the government, they're going to turn right around and get you. So that's how important this particular piece of the law is. Here's when you have to hand it out. During open enrollment, at a qualifying event. What's a qualifying event? You have an employee who gets married and his spouse is eligible for coverage. That's a qualifying event. Has a baby, they don't have dependents coverage. That's a qualifying event. Gets a divorce. I'm not sure how that one exactly fits in, but it's still a qualifying event because that person now has, well, that employee that may be covered under a spouse's plan can now be covered under your plan. Anytime the employee asks, you must provide one of these documents. And if they're in Plan A, you give them one for Plan A. If they're in Plan B, you give them one for Plan B. And if with me handing them out, I give them A, B, C, and D, and whatever else they would need to have. They get a copy of everything. I don't want to be explaining to any judge how they're going to take all my money. The last one is upon request. If an employee walks in and says, I want a summary of benefits and coverage, you have to give them that coverage. Now, if you have an intranet system for your company and the employees have access to that intranet, you can post it on there. But then you have to give them written notice that it's on there so they can go look at it. And if any employee doesn't have access to a computer, you have to give them a printed copy of this document. Now, in one of these slides, it may have been the one in front of that, yeah, it tells you exactly, this is how detailed. It's a 4-page document, front and back, in no less than number 12 font. So what you're seeing there is 8 pages. They just printed. I didn't have the capability to get it done as rapid as I needed it done to put it on duplex. But that's the way this will come. So when you get the notice from the insurance company, treat it as highly important information. If your insurance agent your insurance agent should be in communication with you about this to let you know that these things are coming down the line and it's how important it is for you to pay attention to it. Flexible spending accounts. Now, we've heard about the cap. Right now, there's no cap on flexible spending accounts. If you have one for non-reimbursed medical expenses and you want to put $50,000 a year in, go ahead. This is the one where you don't use it. If you don't use it by the end of the year, you lose it. Well, starting on January 1 of next year, the cap for non-reimbursed medical expenses goes to $2,500. So what if your plan began October 1 of 2012? Does that mean you have to change your plan on January 1 of 2013? No, not at all. You have all the way until October 1st of 2013 to change your plan. So you can put anything you want to in during that period. Most of these plans fall on the calendar year basis, which is the reason why it goes down to $2,500, which affects most people. Child care or dependent care reimbursement remains at $5,000. There was no change in that. And in case you have a flexible spending account, that dependent care side of it applies for adult dependents that you are responsible for, that you take the tax responsibility and all, that need to be in a daycare. You can cover them under it too. Employer responsibility beginning 2014. We're going to have to determine who's full-time and who's not full-time. I'm not sure I remember what all that slide says back there, but the main thing you need to remember is that beginning in 2014, in order to determine how many full-time employees you have to count the part-time employees. And the way you do this is, and this is counted every month. This is not just a once-a-year audit. This is every month you have to count this. And the reason you're counting this is because it affects, whether you're over 50 or over 100 after 2014, it affects taxability to you. But the way you count a part-time employee, you count all your part-time employees' hours worked during the course of the month and divide it by 120, which is 30 hours times 4 weeks. And then you'll find out how many additional full-time equivalent employees that you have. That's going to be important if you have what is considered expensive insurance or if you have no coverage at all. So that starts in 14 and that's on a monthly basis.
Question for you.
Yes, sir.
Does this have employee limitation? Say have to be how many employee and more to do this, or every?
Well, all employers are going to have to do it. Once you trigger over 50, that's where other things occur. But you just need to be sure that if you're under 50, and most of these things don't affect the under 50 employer, but if you have 40 employees and 40 full-time and 10...
Well, you still, say for 10 employees, you still need counting part-time, full-time status?
Probably not. If you got 10 employees, it's probably not going to be a deal. And what you're going to worry about is when you're ticking up near the 50 level, and that's where most of these things that I'm talking about now come in. This next slide is a busy slide. But let me just basically tell you what it says. If you have employees that you provide no coverage for, then there's a penalty of $2,000 per employee. Now, there's another slide later on that talks about this, but I'll just address it right now. If you have, some employers are going to say, okay, $2,000 a year per employee, that saves me about $1,500 per employee because my health insurance is more expensive than this. Well, what you need to know is that your health insurance, as of today, is a tax deduction. This is not. So if you pay the $2,000 penalty, there's no write-off for that, like there is with health insurance. Now, if the laws change and we lose the deductions for health insurance, what's the big deal? But there's another factor in here, is a soft employment factor that comes in. The next thing down here, and I apologize again for the busy slide, but let me just summarize for you. If you pay a portion of the employee's health insurance and the employee's portion exceeds 9.5% of their income, and the plan has an underwriting value of less than 60%, or has an underwriting value rather less than 60%, then there's a $3,000 penalty for having a rich plan. An unaffordable plan is what they call it. I think, yeah, it's unaffordable coverage is what they call this. So the message here is there are lots of intricacies about what's coming, but just know that this stuff is coming down the line, and as an employer, you're going to want to be asking these questions of your advisor. You know, what am I supposed to do here? How's this supposed to work? There is software that's hit the market. I saw it, a sample of it. I didn't see a sample. I saw, what did I do here? I thought I clicked this thing, and I saw a sample of this software, and if I remember correctly, it was like $1,500 that an employer could use to find out what their liability is as the healthcare law changes. I will end up buying this software and running my account's information through it just so that we know, because I have a fear of somebody knocking on my door one day and said, I've just been sued, and by the way, your name's on here too. So we don't want that to happen. So these things that we're showing you now, you don't have a lot of detail here, and that's intentional, but you do have just piquing your interest to let you know that it exists. For those earning more than $200,000 individual or $250,000 as a family, your Medicare goes up almost 1% beginning next year. So Medicare, what is it? It's 7.65. Social Security is Medicare is 1 point something. I forgot what it is, but it goes up to over 2. So Medicare and Social Security combined is 7.65. This is an interesting one. Now, somebody maybe in here can help me figure this out. Beginning in March of next year, we as employers have to notify our employees that they are eligible to go into an exchange. Okay, I got that part. Here's the problem. Georgia doesn't have an exchange. There were 26 states that sued the government to get the health care law thrown out. And those 26 states did not create an exchange. So how quick can we get one up and running? It requires legislation. Our legislature convenes on January the 15th or 8th or something in that time period. And this is effective on March the 1st. And the exchange has to be up and running by October of next year, with accepting members by January of 2014. Well, what is anticipated happening here is that exchange is going to be pushed out. That's going to be not effective March 1st of this year, maybe March 1st of next year. So the reason for that is the federal government, if the state doesn't create an exchange, the federal government comes in and creates it. The federal government cannot create 26 exchanges. There's just not enough manpower and money to do it. So it's anticipated that'll be pushed out. Note to yourself is this is something you need to watch for. Some of the things that are happening in 2014, guarantee issue, no health questions. Modified community rating, which means that they're going to bracket people together in age brackets. I'm making this up, so let's say it's 20 to 25 pays the same premium, and 26 to 30 pays the same premium. Those aren't actual, but I just made it give you an idea. Here's what's going to happen. They anticipate the cost of health insurance going up by 24%. Because what will happen is the young folks that are now paying rates that are equal to their age, when they band rate them, their rates are going to go up, and guess what? Us old guys' rates are going to go down. So some win, some lose, but it's not going to work. It's not going to work the way that we would hope that it would work. The small group market goes from 2 to 50 up to 2 to 100, and then the mandates, which means that you and I, as employers, must provide insurance or pay a penalty and tax for our employees. Just to recap, there is no requirement that you pay for health insurance for the part-time today. Let me back up and say something about these penalties. If enough employers refuse to provide health insurance for their employees, it's already been said that they'll beef the penalty up. So while 2,000 may look attractive to you, 5,000 may not have the same beauty. So the government will just jack the numbers up as an incentive for us to move in that direction. This is that 9.5% thing that I mentioned to you a while ago. The cost of health insurance, you're going to have to track this. When the law first came out, it said 9.5% of the family. I have no idea what my employee's spouse's income looks like, so they now backed it down to 9.5% of the employee premium. And this soft market competition I mentioned earlier, where employers will say, okay, I'll just pay the penalty. The soft market competition would be this. You run a company of some sort and you say, I'm not going to pay health insurance for the employees, just send them over to the exchange, I'll pay the penalty. Your competitor sitting over here saying, I'll pay 100% of the employee premium. Well, that magnet is going to attract your key people over there. That's what they're talking about when they talk about soft market. That's it.